For our first show today, I have a very special guest with me, someone who encouraged me to create this show, someone who has two podcast shows of her own, and the owner of Comfort Killers LLC. And it's interesting that I have her on as my first guest because she actually has had some experience working in medical offices in her early years and also completed some nursing portions of a nursing program towards her own nursing degree. While life has taken her on a different journey into entrepreneurship, I thought it would be wonderful to have her as my first guest and ask some questions regarding her experience in healthcare and working in medical offices and how her experience was within that. So today I will introduce Stacy A. Cross to the show.
Hey, I am Stacy A. Cross, and there is no E in my name. Thank you so much, Shivhon, for having me. I am thrilled to be here. First of all, this is your first show. Congrats. Congrats on the handbook. Congrats on Medical Receptionist Network. It's a much-needed system and tools for individuals just wanting to learn more and know how to develop in their current role.
Thank you so much, Stacy, for that. So please tell us, what was your first position in a medical setting?
Wow. I was in high school and I knew I needed a job. And well, my parents said, you need a job. So right down the street from my high school, it was twofold. I didn't get a ride home very quickly from school. So I needed to fill that time until my brother was able to pick me up. So I said, okay, let me get a job. There was a posting on the bulletin board in school, and it was for Dr. Paniker's office. And I didn't know anything about healthcare other than that I was a volunteer. My mother made sure that I volunteered in the hospital she worked at. So I knew
funny.
this.
I volunteered.
You volunteered?
Probably in that same hospital.
Yeah,
well.
Roosevelt Hospital, huh?
Oh, no, Raritan Bay.
Raritan Bay. Okay, yeah. So, yeah,
okay.
I get it. I worked at Raritan Bay. So so I went there, and it was to just handle filing and just very light, administrative work. I didn't really do any patient face-to-face access or, I didn't take any blood pressure. I didn't do anything. It was just pretty much you had a stack of folders. I remember it was like, what? I felt like I was in the movies where you see all those piles of folders on the desk. And it was like, so I guess I had to collate, get things out. I can't remember fully what my responsibilities were, but it had to do with back office.
Back office. Okay.
Yep.
Okay, so what was your communication like with the front office?
Well,
I'm sure they were giving you, did they give you any requests? Were you the person who had to find things for them or sort through things for them?
You know what? It's so funny because in this practice, I got all my direction from the physician.
Oh, wow.
Yeah.
And see, that's important because everyone listening is going to be a part of a different type of practice. There's no one and done when it comes to healthcare. There are tiny offices that have, 2 staff, 3 staff, and 1 or 2 practitioners. There are huge offices that have, many, many different types of providers, whether they're physicians, nurse practitioners, also, even some holistic, type of medicine mixed in, different campuses, and it's all part of their healthcare center. So it's interesting coming from, and I've worked with small groups and I've worked with, medium-sized to larger groups. So I understand what you're saying when you come from, you were getting the direction right from the doctor, and she was running the show.
And you know what, though? She had a son that would be there after school, and he was so smart. He was only probably 12 years old, but he was running.
I don't know
if
we should say that.
He was no, but he would give me direction.
Running the show.
No, but he was giving me he knew what his mom did, he knew what she needed, and he was just so smart.
Oh, wow.
And so he kind of helped the back office and us high school students get some things together as well. So shout out to.
So let me ask you
years
this.
Old now. Yeah.
Let me ask you this: what do you wish you knew walking into that position?
I was a high school student. I didn't want to know too much, honestly.
But looking back
now, I guess more so of leadership qualities, because I was always that student that very competitive, and I wanted to know more than everyone else. So how could what I'm learning here and what I'm doing, apply in my life, in my school, in my education? without just, grabbing a folder, getting the thing done, and, more of a, like a pep talk. And then, hey, listen, you're starting here, but you could take this anywhere.
Right.
You
right,
know,
right. You could take the skills that
you
you
could
learn
take the
here
skills,
and take them
right,
anywhere, or grow even within that office
Yep.
into another position.
Yep.
But that really wasn't clear to you at that time.
No.
You just thought it was like, I'm here.
Yep.
That's what I'm doing.
Yep.
Okay.
That was my
Have
first
you ever
gig.
worked in any other medical office?
Absolutely. So after that, I feel like, I'm a pro now. I could put it on my resume, finally, something. And I ended up applying and receiving a job at another doctor's office, internal medicine. And I was the only one there.
Okay.
So now I'm running the show, and it's billing, it's patient care, it's front office, it's taking the blood pressure, and I was it.
Right.
So that's when
you were doing triage, you were doing registration,
yes,
front desk, you were answering the phone,
yes,
scheduling.
Yes, scheduling. Yep.
Okay, so now you're in this position. So tell me, at that time, what was your biggest challenge in that position?
Well, number one, it was me by myself. That was the first and foremost. So I had to wear many hats, and once you wear many hats, something falls off. So I would leave billing for a certain day of the week. The system may break down. Now next week, 2 weeks later, and I was overwhelmed.
Right.
I was overwhelmed.
Okay. So the solution to that would have been additional
staff,
a team,
right? Absolutely.
Even a small team, even a one additional person would have made a difference, because you guys could have shared those responsibilities.
Absolutely.
Right. And that happens a lot in healthcare, where we find ourselves in a position where you think, okay, I'm going to walk in and this is my job. And then all of a sudden you've learned 10 new things, and now you're expected to do these things every day or every week, and to really stay on top of that. And sometimes, what helps that is, first of all, to be organized, to understand how much time certain things take, so that you can really say, okay, technically, am I supposed to be able to get these things done? Or is my organization putting too much on me? Should I make suggestions to maybe have someone come in part-time? Or, should I offer additional hours, or maybe they can have just a student like you were in your first position to do the filing, or to do the registration, or to do data entry, or something like that. And those are some of the solutions that I know I've had to implement, and other managers have had to implement in their practice, because as things change, the responsibilities change. What we need to know changes, what we need to do. And it's funny because, as technology came about, it was like, oh, this is going to make things easier and simpler. But at the end of the day, there were things that took less time, but now it transferred into another area, and it now made the process for the provider longer. It made, the data entry on the clinical end longer. So there were other areas that suffered. So you can't always assume, that, you take out one thing and without adding another, that you're resolving an issue. Sometimes you are creating another beast that needs to be managed. So that's great. So tell me, okay, give us an example about, first of all, one of the best experiences you had and something you learned while working in that office, and then tell us one of the worst experiences you had and how you handled that.
One of the best is, in billing, of course, doing everything I had to learn outside, on my own. So I found that billing became a fun thing for me, putting the codes and the CDCs and what is it?
CPTs.
And you know what? And I'm glad we messed.
Codes.
Yeah, ICDs. Yes. And I'm glad we messed up with that. I messed up because it was so long ago.
Right.
This was 2008.
Okay.
So, but what I've learned was the researching behind it. Okay, that's not all codes are one size fits all. And you know what?
I can brought in very specific based on your diagnosis and the reason why the patient actually came in, whether it was a follow-up, initial new patient, things like that.
Okay. And so
you felt good.
I felt good
learning kind of the billing system and what to do
on my own.
And you were always learning
on my own, and I was able to pull more money in.
Wonderful. So what was one of the more challenging, or even a worst experience where whether it was let's go with patient related.
Yeah, this is worse for me. And I asked the doctor this because, you see a lot of reps come in and they have different pills and different, treatments and medication that patients can take.
Right.
And I started noticing, because I had the file, I started noticing all the patients have the same medication being prescribed to them.
So you were doing refills.
Yes.
And sometimes you would notice that the same patients would have,
right.
A lot of patients had the same medication.
Same thing. So, my own person was like, hey, listen, what's this about? I asked the doctor, what's going on? And, I don't want to say the medication because it's just pretty much, but I realized that I don't know if there was something wrong with that, but if I were to be able to be around the round table and discuss, hey, you know what, this is what we're doing, this is why this helps, it helps me feel better to just see that constant. I just didn't like that feeling that I got.
You would have wanted to have a little more transparency into the clinical part so that you could kind of understand what was going on.
I guess it was way beyond my pay grade.
Yeah, it sounds like it. But listen, that's the thing. We can be a front desk staff, right? Medical receptionist. And maybe you see a trend. You see a trend of, patients calling in for refills on certain medications, or you see an increase in something that a different, reason why patients are coming in, because we do get that information. It's all private and, protected, but you're getting that information. If you make an appointment, a lot of times you have to know why the patient's coming in at the bare minimum. And so in that, you're seeing a trend that, maybe put a concern, was a little of your, concern. And the doctor's probably like, why are you worried about this?
Why am I worried?
And I would probably say, why are you worried about this too? Because at that time, they don't have that responsibility. But sometimes in healthcare, I think management, physicians, it is nice for them to share a little information. Like, look, we're seeing an increase in this medication because more people are engaging in X, Y, and Z, or more people are exposed to X, Y, and Z. So, you may see that come, and even just that piece of information may have helped you, not feel uncomfortable about what you're seeing, thinking, to be suspicious of what's going on in the office that you're working in. Yeah. You don't want to work with someone who's doing something that's fraudulent or who's doing something that is, not benefiting their patients. So, people often don't realize that medical receptionists, medical secretaries, they do care. They're very smart people. They care and they notice these things. So that's interesting that you say that. Have you ever had a patient experience that either made you realize how important this industry is, or a patient experience where someone maybe was, not very nice to you, and just how were you able to handle that?
It could go. I'm very good at customer service, so one of my skills is always just being a human. So anyone that comes in the office, my goal is to pretty much give them what they want. And of course, you're gonna get the one or two that, hey, I need to come now. This is what I need. This is on my time, and you gotta just do it. And I said so. I'm the patient, and put me through to this. And I realized that it's okay. Because I'm sitting here behind the desk and I'm perfectly fine. And I don't know how this person, their sickness, their condition is making them feel at that time. Right. So I could either help them and carry them through the best way I could, or I could just not and ruin their day and just go on. I don't know what they're feeling. Right. A lot of these people come in and I could only imagine the pain that they're going through. So one thing I've always done, in part with what happened, was I put myself in the shoe of them. But not only that, I think that they're my family member.
Right. I think that's great.
Yeah. What if that?
And I used to say this sometimes. I said, treat everyone as if it was your mom or your dad or your brother or your sister.
Yeah.
Because you just never know. And there's never an excuse for a patient or anyone who walks in your place of business or where you're employed to be rude and nasty to you. But sometimes, as an employee, there are certain things that we encounter that we have to find the best way to deal with. Yeah. And it's not always appropriate to address things right then and there. Yeah. Maybe, if you find someone who's completely inappropriate, okay, you deal with that the best you can at that moment, and then you bring in your manager, your administrator, or you let your physician, if maybe there's just a physician owner, that manages the group,
Mhm.
of the experience you had with someone, and let them know, because sometimes they're not up there with you, they don't always know what's going on, and it's not at the forefront of their mind because they're providing medical care and trying to make sure they're not making any mistakes, and they're keeping people healthy, and providing them whatever it is they need, no matter what industry. Everyone's not a doctor. We're talking dentists, substance abuse, OBGYN, any, even veterinary clinics. There's medical, you're a medical receptionist, you do the front, you're dealing with the pets and the owners, so there's all types of situations that people deal with in this role as a medical receptionist. So that's important that you mentioned that. And I thank you so much for sharing that. So I have one last question.
Yep.
So now your experience was many years ago, and
many moons ago.
A lot of companies have moved on to electronic medical record systems. So hopefully, we're getting further and further away from piles of paper charts. But I've worked in both scenarios, and I can say there are ups and downs to both. So I just wanted to make that a quick note there. But now, as a patient on the other side, when you walk into your doctor's office, what do you notice immediately?
Immediately, I notice if the person behind the desk does not acknowledge me. Immediately, I notice how many people are in the waiting room, how the waiting room is kept. I guess I'm very detailed, but I look for these things. I notice if that person at the other side of the counter is smiling or not, if their day is going as great as mine or not. I notice the busyness of people. Are they busy? Are they lacking? I kind of take in the energy of the place and the people, and then I can make a decision from them. You know me, okay?
And what decision
I've walked out.
And what decision is this? Is this whether you're going to stay, or
Yes.
whether you're going to come back?
Yes.
Or whether you...
All of it, Shivhon. Yeah. I've walked out of rooms before because a question wasn't answered. I'm one of those types, and I know, here's the thing, with my family and with older patients and older people, they tend to look at it like, whatever the doctor says, I have to go with it. Whatever the staff says, they're an extension of this place, I have to go with it. But of course, now millennials or younger, or generational X, it's like, okay, no, it's just like going to a pizzeria. Okay, you didn't do this. Okay, I gotta go. There's more options out there for me.
Right.
So I look at all that. I take the energy in, and I've made decisions before and left places and made another appointment somewhere else because of the energy, because of the attitudes, because questions weren't answered, because they weren't transparent.
And that's interesting. And I cover some of this in the Medical Receptionist Network handbook, because it's very important that the first impression is serious. Now, everyone may not do react the same way Stacy has. I personally, usually, if I go somewhere, if I go into an office, I'm pretty much paying attention to a lot of the same things. How long did it take for someone to acknowledge my presence?
Yeah.
What manner are they communicating with me in? And sometimes you will be surprised how many times that experience could make that day that you walked in there be the last.
Yeah.
There's medical offices that I've been to where I didn't feel comfortable. And I'll say this, and most of the time it does end at the front desk. I made an appointment with a dental office years ago, and when I called back, I guess the hygienist had left for the day. I was halfway there. The person went home sick, but the person on the phone providing the information was so rude, I never went back. So the front desk has a huge impact on how, on retention. And that's why I say, these jobs are very important, because they're going to keep people coming back. Right. People, are going to know your name, especially in an office where you have patients that have to come all the time. They develop that relationship. First of all, they like to see the same people at the front. They don't want, the person that was there last week's not there this week, and this one's got, let go. So, you like that familiarity, especially if you're ill or you have that regular visit. It's different when you go once a year, but, a lot of offices, their patients are a certain population of their patients that go very often. So they know the office, they know when something's going wrong, and they know what to expect. And hopefully you're keeping a consistent path of customer service and quality, and keeping the standard high for those patients that are so dedicated to the practice. Because in many areas, like we're here in Philadelphia, there are tons of options. Now, granted, when you're in a more rural area, you may not have that. But a lot of people have many options now, and, they can make a decision to go see someone else. And whether they like the physician or not, if everything else in the office doesn't speak to them, you may lose that patient. So it's very important, the customer service aspect. And we're going to talk so much about that. We're going to meet tons of medical receptionists and medical secretaries, unit secretaries. This podcast will be coming to you every week, and we will have someone new on to talk about their experience, what industry. And now, was the second office you worked in, was that primary care as well?
Yes.
Okay, primary care. So, we're going to have everyone from different specialties, different levels of experience, so we can just, get the tips and tricks, things to help you be better at what you do. And hopefully you can contact me, and we'll have you on and find out, what makes your experience beneficial to your office and why you're such a value to them. And I look forward to asking all of my rounds of questions. We're going to have kind of rapid fire type of questions for everyone, and want to share the message and share our resources with you.
Yeah.
We have the medicalreceptionistnetwork.com website. You can also join us on Facebook. You can like our page and join our Facebook group, both at Medical Receptionist Network. And you can follow us on Twitter at Receptionist Net. And I think that's about it.
I think this is great. I think this is a great resource. Wish I had it when I was in high school.
Oh, yeah. And we have a training coming on a nice certificate program, and we're going to bring everyone together in this area of healthcare, because I think it's very important. We're not going to undervalue anyone in the healthcare industry, and it's time for medical receptionists, medical secretaries, and unit secretaries to get their due. So we're going to start here. Thank you for coming, and we'll see you again next week.
Awesome.